Bone is a specialized connective tissue. It is hard, non-pliable, and vascular. Bones provide support, protection, and shape to the body, and also act as a storehouse of minerals.
Bone is a strong connective tissue with a hard outer compact layer and a porous inner spongy region containing bone marrow.
Based on their shape, bones are classified into 4 types: long bones, short bones, flat bones, and irregular bones. Bones are classified into long bones like the femur and humerus, short bones like carpals and tarsals, flat bones like the skull and sternum, irregular bones like vertebrae. A typical long bone consists of the proximal epiphysis, metaphysis, diaphysis, medullary cavity, distal metaphysis, and distal epiphysis. The medullary cavity contains The microscopic structural unit of compact bone is the osteon. At its center lies the Haversian canal containing blood vessels and nerves. Concentric lamellae surround the central canal. The structural unit of compact bone is the osteon. It contains a central Haversian canal surrounded by concentric lamellae. Osteocytes lie inside lacunae,
interconnected by Volkmann's canals, that transmit vessels and nerves from periosteum to osteons.
Spongy bone contains a network of trabecula, making the bone lighter while providing structural support and spaces for bone marrow.
Spongy bone, also called cancellous bone, is made of trabeculae. The spaces between them contain red bone marrow where blood cells are formed.
Osteoprogenitor cells divide to form osteoblasts, matrix, and initiate calcification. Maintain the bone matrix, while osteoclasts break down old bone during remodeling. Osteoblasts form bone, osteocytes maintain the matrix, and osteoclasts help in bone resorption and remodeling. Bone matrix contains collagen fibers and inorganic mineral salts, mainly calcium phosphate,
calcium carbonate,
which provide flexibility and strength. The organic component forms about 1/3 of bone and consists mainly of osine, which provides flexibility. The inorganic component forms about 2/3 and
The skeletal system forms the internal framework of the human body and supports, protects, and gives shape to the body. The human skeletal system consists of 206 bones and a few cartilages. The skeletal system is divided into the axial skeleton and the appendicular skeleton. The axial skeleton includes the skull, vertebral column, sternum, and ribs. The appendicular skeleton includes the bones of the limbs and the pectoral and pelvic girdles. The skull is composed of cranial and facial bones and protects the brain and forms the framework of the face. The vertebral column consists of 26 serially arranged units called vertebrae in the adult human. The vertebral column is differentiated into cervical, thoracic, lumbar, sacral, and coccygeal regions. The vertebral column protects the spinal cord and supports the head and trunk. The rib cage is formed by the thoracic vertebrae, ribs, and sternum, and protects the heart and lungs. There are 12 pairs of ribs, each attached dorsally to the thoracic vertebrae. The first 7 pairs of ribs are true ribs because they are directly attached to the sternum through their own costal cartilage. The 8th, 9th, and 10th pairs of ribs are false ribs because their cartilages join the cartilage of the rib above. The 11th and 12th pairs of ribs are floating ribs because they are not connected to the sternum. The sternum is a flat bone situated in the middle of the thorax and forms the anterior part of the rib cage. The pectoral girdle attaches the upper limbs to the axial skeleton and consists of a clavicle and a scapula on each side. The upper limb consists of the humerus, radius, ulna, carpals, metacarpals, and phalanxes. The pelvic girdle attaches the lower limbs to the axial skeleton and consists of 2 coxal bones. Each coxal bone is formed by the fusion of the ilium, ischium, and pubis. The lower limb consists of the femur, tibia, fibula, tarsals, metatarsals, and phalanxes. The femur is the longest bone of the human body and forms the thigh region. The patella is a sesamoid bone located in front of the knee joint. Bones are hard connective tissues with a strong mineralized extracellular matrix. The bone matrix contains collagen fibers and inorganic mineral salts that provide strength. The bone matrix contains collagen fibers and inorganic mineral salts that provide strength and rigidity. The organic protein component of bone matrix is mainly osane, while calcium salts contribute to hardness. The major mineral components of bone include calcium phosphate and calcium carbonate. Bone cells are called osteocytes and are located in spaces called lacunae within the bone matrix. Compact bone is dense and forms the outer layer of bones, while spongy bone contains a network of trabeculae. Compact bone is organized into cylindrical structural units called osteons or Haversian systems. Each osteon contains concentric lamellae arranged around a central Haversian canal. Haversian canals contain blood vessels and nerves that supply the bone tissue. Bones serve as storage sites for minerals, especially calcium and phosphate. Bones undergo continuous remodeling through the coordinated activities of bone-forming and bone-resorbing cells. Calcium exchange between bone and extracellular fluid is regulated by hormones and helps maintain calcium homeostasis. The joints are the points of contact between bones or between bones and cartilages. Joints hold the skeletal system together and permit different degrees of movement. Fibrous joints are immovable joints in which bones are joined by dense connective tissue. Cartilaginous joints allow limited movement and have cartilage between the articulating bones. Synovial joints are freely movable joints containing a fluid-filled synovial cavity. A synovial joint is surrounded by a capsule and contains synovial fluid that reduces friction. The ball and socket joint permits movement in several directions, as seen at the shoulder and hip. The hinge joint permits movement mainly in one plane, as seen at the elbow and knee. The pivot joint allows rotational movement, as seen between the first and second cervical vertebrae. The gliding joint allows bones to slide over one another, as seen between the carpals. The saddle joint permits movement in two planes and is present at the base of the thumb. Myasthenia gravis is an autoimmune disorder that affects neuromuscular transmission and causes muscle weakness. Muscular dystrophy is a progressive disorder involving degeneration of skeletal muscles. Tetany is characterized by rapid spasms of muscles due to a low concentration of calcium ions in body fluids. Arthritis is an inflammatory disorder of the joints that can cause pain and stiffness. Osteoporosis is a condition in which bone mass and bone mineral density decrease, making bones fragile. Gout is a form of arthritis associated with the accumulation of uric acid crystals in joints. The appendicular skeleton is connected to the axial skeleton through the pectoral and pelvic girdles. The skull is the bony framework of the head and is divided into the cranium and facial skeleton. 66. The vertebral column extends from the base of the skull to the pelvis. 67. The vertebral column is made up of vertebrae separated by intervertebral discs. The ribs are thin, flat, curved bones that form the lateral walls of the thoracic cage. The ribs are connected to the sternum anteriorly through costal cartilage, either directly or indirectly. The clavicle is commonly called the collarbone and connects the upper limb to the trunk. The scapula is a large triangular flat bone situated on the dorsal side of the thorax. The glenoid cavity of the scapula articulates with the head of the humerus. The humerus is the bone of the upper arm. The radius and ulna form the skeleton of the forearm. The carpals form the wrist, the metacarpals form the palm, and the phalanx form the fingers. The pelvic girdle provides attachment for the lower limbs and supports the weight of the body. The acetabulum is the socket of the pelvic girdle that articulates with the head of the femur. The femur articulates proximally with the acetabulum and distally with the tibia. The tibia and fibula form the skeleton of the lower leg. The tarsals form the ankle, the metatarsals form the foot, and the phalanx form the toes. The bones of the skeleton are connected to one another at specialized sites called joints. The structural classification of joints is based on the nature of the tissue connecting the bones. The functional classification of joints is based on the degree of movement permitted. Synovial joints are characterized by the presence of a fluid-filled synovial cavity. Ligaments are strong connective tissue structures that connect bone to bone. Tendons are strong connective tissue structures that attach skeletal muscles to bones. Articular cartilage covers the ends of bones in synovial joints and reduces friction during movement. Synovial fluid lubricates the joint and facilitates smooth movement. The acetabulum is the socket of the pelvic girdle that articulates with the head of the femur. The femur articulates proximally with the acetabulum and distally with the tibia. The tibia and fibula form the skeleton of the lower leg. The tarsals form the ankle, The metatarsals form the foot, and the phalanx form the toes. The bones of the skeleton are connected to one another at specialized sites called joints. The structural classification of joints is based on the nature of the tissue connecting the bones. The functional classification of joints is based on the degree of movement permitted. Synovial joints are characterized by the presence of a fluid-filled synovial cavity. Ligaments are strong connective tissue structures that connect bone to bone. Tendons are strong connective tissue structures that attach skeletal muscles to bones. Articular cartilage covers the ends of bones in synovial joints and reduces friction during movement. Synovial fluid lubricates the joint and facilitates smooth movement. The shoulder joint is a ball and socket joint that permits movement in many directions. The hip joint is a strong ball and socket joint that supports body weight. The elbow joint is a hinge joint that permits flexion and extension. The knee joint is a hinge-type synovial joint that permits mainly flexion and extension. The joint between the atlas and axis is a pivot joint that permits rotation of the head. The joints between the carpal bones are examples of gliding joints. The joint between the trapezium and first metacarpal is a saddle joint. Movement of the body occurs through the coordinated action of the skeletal and muscular systems. Skeletal muscles are attached to bones by tendons and produce movement by contraction. Bones act as rigid levers, while joints act as fulcrums during movement. The contraction of skeletal muscles produces force that is transmitted to bones through tendons. The coordinated action of bones, joints, and muscles produces locomotion. Calcium ions are essential for normal muscle contraction and bone metabolism. Bone tissue is continuously formed and resorbed throughout life. Bone remodeling helps maintain bone strength and mineral balance. The mineralized matrix makes bone stronger than most other connective tissues. The organic component of bone provides flexibility, while inorganic salts provide hardness. The combination of collagen and mineral salts gives bone both strength and resilience. The arrangement of compact and spongy bone varies according to the function and location of the bone. Long bones have a shaft called the diaphysis and expanded ends called epiphyses. The medullary cavity is present within the shaft of a typical long bone. The outer surface of bone is covered by a connective tissue membrane called the periosteum. The ends of long bones are covered by articular cartilage at synovial joints. The periosteum contains blood vessels, nerves, and cells involved in bone growth and repair. Osteoblasts synthesize and deposit new bone matrix. Osteocytes are mature bone cells that maintain the bone matrix. Osteoclasts are involved in the breakdown and resorption of bone tissue. Bone remodeling depends on the balanced activity of osteoblasts and osteoclasts. The microscopic organization of compact bone allows efficient nourishment of bone cells. Lacunae containing osteocytes are connected by tiny channels called canaliculi. 127. The microscopic organization of compact bone allows efficient nourishment of bone cell.